Hello, sir. Good morning. I am Anne-Marie P. Basa from Mindanao State University Buog Campus, a first-year nursing student. Assessing cardiac and peripheral vessels. For the definition, assessment of the heart and peripheral blood vessels to evaluate circulation, heart function, and blood flow throughout our body. And the purpose is to assess the circulation and oxygen delivery, and also it is to identify if there are any abnormalities in our heart and blood vessels. The equipments needed are the alcohol and the stethoscope. The things you need to consider before, during, after the procedure. First, you need to perform hand hygiene, identify the client, explain the procedure, and ask for permission. During, you need to evaluate the pulse, the rhythm, and the strength of the pulse. Then after, you need to perform hand hygiene and documents the findings accurately. At first, we need to perform hand hygiene. Wear gloves. Ma'am, good morning po, ma'am. Naapo ta diri ma'am, para mag-assist ko sa imong heart and peripheral vessels, ma'am. May I ask your permission po, ma'am? Pero ma'am, before that, may I know your name po? Your birthday? Ma'am, kana na ang hika po sa mga insensitive parts sa imong body, ma'am, ha? If okay lang sa inyo, ma'am, para ma-perform tani nga procedure. Sige po. And procedure number 1, you need to palpate the carotid artery. Lightly place your finger just medial to the trachea and below to the angle of jaw. For the rationale, the pulse should be in a regular rhythm and equal strength for both arteries. This is also to identify if palpable vibration or trill are present. Ma'am, wala na po kayo mag-clinic na po? And next, you need to auscultate for vascular sound over the carotid arteries. And for the rationale it is to help to determine the presence of blood. And next, you need to inspect the internal and external jugular vein to determine for the types of pulsation it produces. For the rationale, the internal vein has a softer undulating pulsation, and the vein is normally protrude when the patient is lying down and lies flat when he stands. This is also provide information about the volume of blood vessels and pressure in the right side of the heart. And next, you need to inspect and palpate the aortic and pulmonic areas. Note for any pulsation. And for the rationale, this is to detect abnormal pulsation and assess heart and blood vessels function. Ma'am, wala ra po kayo makilma sa palpate po na po. Wala ra? Wala ra. Upon pulsation po, the patient, wala po siya naka-feel og sakit. So next, you need to inspect and palpate the epigastric area at the base of sternum for abnormal aortic pulsation. And for the rationale, it is to identify if there are any unusualities in the abnormal aorta and provide prompt nursing intervention. Ma'am, wala na po yung sakit, ma'am. So for the next procedure, you need to place the client in a semi-fowler position, then you auscultate the aortic, pulmonic, tricuspid, and apical area. Use both the bell and the diaphragm of the stethoscope. And for the rationale is to identify the S1 and S2. Ma'am, magbutang pa ka na ng online ko dapat sa mga rin ha para ma-position din to ano ha, correct position. Comfortable na po ka, ma'am. Pwede. Babalik ka magpapalit. Okay na po. Then, you need to auscultate using the bell and the diaphragm of the stethoscope. So upon auscultating the pulse of the aortic, the pulmonic is normal. So for the next procedure, for the peripheral system, you need to inspect the peripheral veins in the arm and legs. You need to note for any temperature and any presence of the edema. And for the rationale, it is to assess circulation and identify sign of poor blood flow, edema, or veins abnormalities. Ma'am, lantawan na to ang among ma'am ha. Imong paa ma'am sa leg support. Okay na ma'am? Okay, upon inspecting po, the legs and the arms is in the skin condition is normal, and the skin color distribution is normal, and the temperature is also normal. And the next procedure is you need to palpate the peripheral pulses, the temporal, radial, brachial, inguinal, femoral, and posterior tibial. And it is to palpate the pulses on both sides of the body and systematically. And for the rationale, it is to help to evaluate the pulse, strength, symmetry, and adequacy of blood circulation. ma'am. Then femoral. Then the popliteal. And the dorsalis medial. And next, you need to palpate or auscultate for apical pulse. It is for to assess the heart rate and rhythm accurately. And the rhythm of the apical pulse, it is normal. And it is normal, so it is 2. For the procedure number 10, you need to assess the pulse rate and the rhythm equally amplitude on the scale 0 to 4. For 0, there is absent or not palpable. 1, diminished or barely palpate. For 2, it is normal. And 3, it is full or increased. Then, for the rationale, it is to determine if the effectiveness and output of to detect abnormalities in circulation. So, upon auscultation of the apical pulse to our patient, it is 2, it is normal. And for the next procedure, you need to assess for the peripheral leg veins for any signs of edema, varicositis, and phlebitis. You need to grade for feeling edema as class 1, class 2, class 3, or class 4 according to its group. For the rationale, it helps to identify varicositis problems and to determine the presence of severity of edema. Ma'am, kanan nang i-check po na ko imong kamot ug imong paa, ma'am, if nabay present sa edema, ma'am. Okay ra po, ma'am, atong expose. Okay. Ma'am, imo na pong paa, ma'am. So upon checking po, there are no sign of edema, there are no sign of varicositis, and so it means it is normal. And for number 12, you need to assess for arterial and venous insufficiency. For the rationale, it is to help to identify adequacy of the blood flow and detect circulation disorders or abnormalities. So, upon checking po, it is normal. So, ma'am, upon assessing you, ma'am, there are any no sign of abnormalities, ma'am. So, it means it is normal. So, ma'am, thank you for your cooperation po, ma'am. Then, after explaining to the client about the result of assessing, you need to remove your gloves and dispose it properly, and then perform hand hygiene.